I experienced pregnancy loss for my first pregnancy. Me and my husband started trying to get pregnant in 2023. About, I would say, 6 to 7 cycles before we actually got pregnant, which was tough. But when we finally did, it was a huge, exciting time. But I will say the first couple tests I took were very light. It did eventually start to get darker, so that gave me a little bit more hope. I called my OB and told her that I did get a positive pregnancy test, but they are pretty light, and she suggested that I go ahead and come in. So about that time, it was probably about 6 weeks. So I went ahead and I went in, and she wanted to do a blood test just to check the levels of the pregnancy. Once she ran those numbers, she gave me a call, and she did seem a little concerned about the levels. They were on the lower end of where I should be at 6 weeks. With the next couple days and getting these levels checked, my HCG was looking good. It was rising, but my progesterone was not. So she was concerned that there's something wrong. And her first thought was thinking that it may be leading to a miscarriage. It was very heartbreaking to hear, and I may be smiling through this, but that's just kind of my way to cope with it. So I just want to add that in there. Once I found that out, I was very anxious and I kind of lost control, and I looked things up on Google, which I don't recommend. Don't spiral and look things up because it's just going to make things worse. And if you're stressed, that's obviously going to cause extra things, but I know it's impossible not to be stressed while going through this. I understand completely. Once I got that news, it was, I think, a day or two later, I got this really sharp pain in like my stomach area, kind of up into my chest. And I thought that was really strange. I've never felt anything like that before, but I also thought it could be a normal symptom of pregnancy. So I went ahead and I called my OB and I told her what I was experiencing, and did not get the response that I would have hoped for. She did say that she was concerned that that may be a symptom of an ectopic pregnancy. And she said that if I do experience it again, or if it gets stronger and more painful, or if I do start to bleed, that I need to go to the hospital. So after that occurred, I was very distraught. I felt the pain again. It wasn't as intense, but by that point, I was ready to go to the hospital because I just wanted to see what was going on, and I wanted to make sure that my baby was okay. So this is the part where I may get a little emotional just because this is very tough. But me and my husband went straight to the hospital, and we had to wait in the emergency room. And they took me back for an ultrasound. I was still very early on, probably like 7 weeks or so. And by this time, they can get a heartbeat, but sometimes they can't. They should be able to see like a sac or something in there that shows that there's something viable in there. So she went ahead and she did the ultrasound, and she was having a lot of trouble finding anything. And she looked obviously in the uterus where a pregnancy would normally implant. We had to wait. And then we got admitted just because they were having a lot of trouble and they didn't want to immediately send me home due to my symptoms. Then I got another ultrasound from another tech in the morning, and she was able to find a sac, but it was not in the uterus. It was in my tubes. And I didn't know what any of that meant. So I had a doctor that came in, which was not my OB, it was another OB from the office that I do go to. But I was experiencing an ectopic pregnancy. So she did give me two options: that I could go ahead and have the surgery and remove the tube, or I also could take methotrexate, which I think it was a shot. So I went ahead and I went with methotrexate because I wanted to keep my tubes, but I was just very scared and I didn't know really what to do. So I went with the shot. So they give you that in the hospital, and then they kind of monitor you for a few hours and just make sure you're okay and everything. And then they go ahead and discharge you. So that's what they did. We went ahead and we went home. And I will say that that night, nothing really occurred. Like, I would say early into the night. Once we got later into the night, into like the overnight, that's when things started happening. So the pain was excruciating. Um, this is really tough. It's a lot of pain, a lot of bleeding. I had to go ahead and get in the tub. My husband was there to support me. Thank God. If you've went through this by yourself, I'm so sorry. So sorry. If you've went through this at all, I'm so sorry because it's excruciating to lose your child and then to feel the loss occurring in you is really tough. If you went through this, I know exactly how you feel, and I know that it's one of the hardest things to get through, if not the hardest. The next couple days, I was pretty sore and tender and very depressed. After you have the passing They will have you come in and continue to get blood tests to make sure that your levels go back down to normal. So not only did I have to go through losing my child, I had to go to the office and see other women currently pregnant. And I had to sit there and wait next to women that were about to have their babies or just found out they're pregnant or just got an ultrasound for the first time. And I had to know that I just lost my baby and I'm just here to see that my baby is fully gone from my body. So that's tough. Sorry. Once my numbers did go fully down, which they did, which was great, because that means that we're in a good place, and if we want to try again, we can. With methotrexate, I know it's different. I think when you have the surgery, but you can start trying pretty instantly. My OB was fine. Like if we wanted to start trying again, which was tough. It was a conversation that I think me and my husband were just we were back and forth. Do we want to keep trying? Do we want to pause and stop for a minute? And I think we both came to the terms that we know we want this and we know that we're going to be blessed and we're going to be able to get this gift from God and we just have to keep trying. So that's what we did. We started trying again. It took even longer than it did the first time, but we did get pregnant. And all of the tests were super dark and they just kept getting darker and darker. And I went in, and obviously, once you have a loss, if you have a wonderful OB like I did, they bring you in early to check your levels and make sure everything's going normally. And when she checked my levels, my numbers just kept rising and rising. And we only had to do a few blood tests. And then she was like, "You're good to go. This pregnancy is looking great." So everything went well. I mean, obviously there was still like ups and downs with any normal pregnancy, but she's here. She's beautiful. She's everything I could have ever wanted. I could have ever asked God for. He gave me everything and more. And I do have that angel in heaven that I think about all the time. So I just want to let you guys know that if you're going through this and you're experiencing loss, whether it's an ectopic, whether it's a chemical pregnancy, whether it's, a stillbirth or you any medical thing that caused you to lose your child, anything, I'm so sorry, but there is a light at the end of the tunnel, and you're gonna get that gift, and you're gonna get your baby.